keynote address. I don't know who put that in the agenda. My name is Eric Prasad. I am with the National Institute of Environmental Health Sciences Worker Training Program as a health specialist, whatever that means. This program funds and provides leadership and support as it comes to worker training and education, specifically and mostly towards hazardous material work and emergency response. But, that encompasses almost every work when you think about it. And my connection to the worker training program is a bit an unconventional route. I imagine many people here in the room have found themselves in unconventional routes to where you are now. And that's just the same for how I got involved in the opioid epidemic. And Mitch, forgive me, I have slides, but at the NIH you have to go through this process, you have to red tape and this and that for slides. And I don't think anybody wants me to go through slides. So I'm just going to talk, if that's all right. I'm just going to talk, and then towards the end, I'll go through the slides quickly and make sure that you guys have my contact info. So, I had graduated with a degree in 2013, my undergrad degree in geology. Go figure. And I needed to work quickly. My mom had gotten very ill, and I needed a job ASAP, right? So I decided that I'll just do my master's online, and I'll find a job. And when I had graduated, there was a partnership with Rutgers University. I went to City College, New York, and they had a partnership with Rutgers University to do this training program, this 40-hour HAZWOBER training. HAZWOBER is this emergency response and hazardous material training, where you learn to put on, those spacesuits and the respirators and all that stuff, and you learn how to do this hazardous material work. And this small New York City construction company saw I had the training, and ironically, this training was funded, I didn't know it 10 years ago, but it was funded by the worker training program. So, another go figure. And the employer thought I had this training and hired me as a geologist. And it's dirty work, it's rugged, it's rich, and you get out there and collect samples and this and that. And I did like the work itself, but I was miserable at this job. I was miserable. And it had nothing to do with the work, but my supervisor, the senior geologist, he used to bully me, curse me out, say racial slurs, really difficult conditions. He tried to get me fired multiple times, and it was just not a great place to work because of that. And I think I had reached this boilerplate moment, at my edge. And I was in the office, the shop, and we had two local 1 plumbers. They were our local 1 plumbers. And they were talking to our VP, Bob. And we had just won this big chemical contract to do work at sewage treatment plants. That and a few other chemical contracts, but it was kind of new work for them. And he told them, these two guys, to go into the tank. There's a chemical tank they had to clean. Go into the tank. First of all, you don't send two people to go into a confined space. That's the first red flag right off the bat. But he had told them to drop this chemical into the tank, and it'll neutralize it. And I could tell which one of y'all back here are taking chemistry or something because you're looking at me funny. Those two chemicals would have caused this explosion. And I looked at, I'm 23, I'm kind of quiet at the point, go figure that too. And I cursed them out. And I was like, oh, what are you, I won't say that word out here because we're in a professional situation. But, there was I'm sure he responded in 1 second, right? I'm sure he responded right away. You know that frying pan thing, right? And I'm over there thinking, all right, so what should I do now for a living, And he's like, oh, Eric, you know this stuff? You should go with them. And that is how I entered the wonderful world of cleaning chemical tanks and doing hazmat work. And I know it doesn't look it now, but I did. And through that work, I would see so much of the pains that are associated with this kind of job. I would see the physical and emotional pains of such work. And not just see it, but experience it myself. I remember I had just started off and we had to move, this is real dummy work, we had to move steel and metal pipes and PVC pipes from one lot to the other end of the lot. Not rocket science, but it's labor. And the day before on the job, I had rolled my ankle. And I rolled it really, really badly, and it overnight got big and fat, like one of those mic subs that your stadium's named after. And I was like, I can't miss a day of work. I can't miss a day of pay. I need the money. I need every day's money. I got bills to pay. Y'all got bills to pay. You know what I'm talking about. And I went and I took my steel boot, the steel toe boot, whatever, and I cut 2 slits on the ends. So there'll be more room, more give. And I put my boot on. I didn't tell nobody. For weeks I was in pain, especially the first couple of days, agonizing pain. And I worked with it. I didn't tell nobody, because you know what, if you told somebody, 2 things would happen in the construction industry. One, there's this toxic masculinity that comes with the work. And if you look like you're weak, nobody will want to work with you, right? And you look like you're weak in a dangerous job, no one definitely wants to work with you. You're a liability, right? And also, I needed to pay. If I missed that work, I wasn't going to get paid. They weren't going to try to do something evil to me. It was like, you have to go home. Likely they would have, and at times they did send me to the office when we were slow, because I have some office skills, or I think I have some office skills, is what I do now, right? And I would work through it. But you know, so many people would go to the job and they would do the same thing I did, but they weren't 23. They didn't get the lucky spring back and maybe work out fine in a couple months. They kept doing it year after year, maybe decade after decade. After a while, you need a surgery. You know how many guys I worked with who had to have a surgery and come back the same week from their surgery and work? It's not 1 or 2 cases. It's not 1 or twice in this one occupation. It's a common thing. I remember we would have a guy come in, and he would come in drunk. Drunk. We started like 7 a.m. Latest 7 a.m. Usually we start at 5, 6 in the morning. I'm not talking about hungover. I'm talking about drunk. You know, the Georgie's still viscerating off of his breath. And I was the foreman for the chemical work, so I was telling him to shut up. Get in the back of the truck, don't you say a word. Get in the back of the truck, and we're going to go to the job site, and we're going to find some trench or sump or one of the manholes, and we put you in there. And we put a shovel or a broom next to him, and a shop vac in case he had to hurl, right? You don't want to put in a bucket there, because if you put a bucket, everybody can see the bucket, right? So you put a shop vac. And we did that so if someone was coming to look at the site, wouldn't be able to see them right away, because they're underground, right? And you don't want them above ground before they fall over. And we would let them sleep it off, right? And this is not something that I just came up with. It wasn't something ingenious to my mind. This was something that the older guys told me to do, that they had learned from other job sites. This is something that happens everywhere around the country. This is a lesson that we learned from someone else. That's how we handle this problem. And of course, I ain't no charity case. So, you know, by lunchtime, he sobers up a little bit. He's doing all the work. Me and the other guy kind of relax, so don't worry. Sometimes we even have this one guy, and he would come in, and I know I keep saying guys, it's a very male-dominated field, but there are some women in these situations I'm talking about, some men in the job. But there are women in the field, and there are women who are going through this problem too. And he would just be bawling, crying, bawling, tears flowing. He was going through this difficult divorce, right? Ain't nobody talking about that being pain, but it's pain. He was going through divorce. And he would also be drunk, completely hammered, 6 in the morning. And I'm a little bit ashamed to say this, but we would break a tool or an equipment, or take one of the, there's always something broken, one of the broken pieces of equipment, and have him go to the back of the shopyard. We had these shipping containers in the back of the shopyard, and let him fix it all day. So he'd be completely out of sight. You can't see him. He's in the back of the yard. And we just leave him there for the day so he can cry it out in peace. And then sometimes, he would be so distraught, so emotional, that we didn't even want to give him a broken tool or equipment, because then he would be operating a power tool. And we would say to each other, you know, DJ looks a little bit emotional today. Let's not give him a power tool today. And we would have him pretend to fix a tool all day. I remember before we would start any job, before we ever entered a tank or anything like that, we would take this smoke break. I don't smoke, but we would take this 10-minute smoke break every time. We would get started, get set up, and a couple of us, and we would walk off to our corners. If you had your car, go in your car. Senior guy would get the truck, whatever. And you would call somebody that you love. You would call your wife, your girlfriend, your spouse, maybe a good close friend of yours, somebody, right? And we did that because we weren't sure if we were coming home at the end of the day. And that's not something that I'm just saying that we thought about. It's something we talked about. We would tell each other, hey, you don't know if you're coming home today. Take a minute. Right? That was the kind of environment that we worked in. And that's the kind of environment that so many people in this country work in. There is a problem not just of drugs and addiction in this country, but how we handle physical and emotional pain. And although we know the occupations and industries, we know them, that are at greatest risk. We know the populations. You just saw the stats that the wonderful keynote just gave. We know who is at greatest harm. We continue to see the lack of policies and programs that protect those people and save those lives, such as paid sick leave or recovery-friendly workplaces. At the time, the director of the worker training program, Joseph Chip Hughes, he kind of saw some of the work I was doing. I did my thesis, my master's thesis on chemical tank cleaners and the risk perceptions and training gaps for some hoopla. And as well as looking at fentanyl and first responders and their training gaps. And they had long recognized that there was a need to raise the awareness of workers to drugs in the workplace. So we put together a training program and piloted it in the summer of 2019. And I was their evaluator. And some of you may know Jonathan Rosen, he was the instructor. And we started off in Hanford, Washington. Right? Hanford, Washington. We were in person. This was 2019, pre-COVID, so we didn't even have to say in person, you know, it was just assumed in person. And we had about 30 trainees, right? And they were from all around the country at these different Department of Energy facilities. And it makes the connection because that work has a lot to do with nuclear waste cleanup, so there's the connection to hazardous waste and such. And the 30 trainees were, you know, health and safety representatives, union reps, people that were in the know and well knowledgeable of the importance of protecting workers, right? And we gave a 6-hour training, and it was just pin drop quiet for 6 hours. And if any of y'all know trainers, you know they don't shut up, right? They just talk. And we asked, you know, what's going on? What's wrong? Talk to us. And they just tore into us. They were so mad that we were calling opioid use disorder a disease and not a lack of willpower. that we were enabling drug users. Furious at us. So we went back to the hotel, took a breather, and we showed up the next day at the Hammer facility, the training facility for DOE. And we had this round table. It's not really a round table, it was a long table, but you know, round table format. And we had congressional staff people, what's the other stuff? The senatorial staff people, we had DOE people, our people, WTP. We had a lot of prominent doctors and community leaders there, right? In this very formal, rigid, hey, how you do? My name is so-and-so, and I do this and this. Oh, nice, thank you, right? And adjacent to the table were these rows of seats. And in the rows of seats were the trainees from yesterday. So they had to come in and listen. I guess they were forced to come and listen. I don't know if they were willing to come in and listen, but they came in. And they were pretty quiet. They were supposed to sit and listen. And halfway through, one of the guys kind of like raises his hand, like can I get up and say something? And I'm like, yeah, finally, please. So he gets up and he says, hey, I'm in recovery, I'm an alcoholic in recovery for 20, 30 years, right? Maybe right now in this room that doesn't sound remarkable, but at the moment, for him to talk at the Department of Energy, where, by the way, there is a punitive policy that if you talk and are found to test positive for drugs, you lose your security clearance and essentially your job. There is a culture in place to not talk. Now, there's been some inroads on that, but at the time, it was a remarkably brave moment from their union leader. And something even more remarkable happened the moment after he spoke up. We went to talk to those trainees, those 30 trainees. I guess it was my job, I was the evaluator, I had no choice, but I talked to those trainees. And of course, like everyone here in this room, you know someone who's dealing with an addiction. As everyone else you know in this country, unless you live under 10 feet of rocks, you know. But some of those trainees that were furious with us, we would learn about them. I had one woman come on my shoulder and cry that her sister had just died a month ago of an opioid overdose. And this same woman was furious at us yesterday. I had another guy who didn't say anything yesterday tell me that he was on heroin. And I ain't talking about 3 years ago was on heroin. I'm talking about 3 days ago on heroin. This is the same class that can't speak up. This is the same class that was lambasting us the day before. So we realized that we need to do so much more to address stigmas. That a 6-hour awareness training that we just spit out a bunch of facts at you ain't going to change your worldviews and your preconceived notions. It's going to take a lot more work. So we went back and we really emphasized bringing in people with lived experiences and getting their input into this work, and remodifying some of the tools and activities that we were doing during the training to make sure that we were making people comfortable talking about the uncomfortable, right? And we saw a dramatic shift. The very next week, we went up to the New England Consortium, which is in, ironically, New England. And we're in New Hampshire, and had a bunch of training consortiums come together. And we saw that through their pre and post tests and the discussion of the trainees, they were much more differently viewing that opioid use disorder is a disease, and it is not a lack of willpower, right? That this is a disease, and that people deserve help. The next week, we went up to the steelworkers in Virginia. And we would have one man come up to me and tell me, a man that was dealing with an opioid addiction, that he would have rather died than go to his employee assistance program before this training. That's what it takes to, when you come after stigma and you educate folks. The last training we had for that pilot in the summer was actually a Rutgers consortium, sub-consortium. It was the New York City Carpenters Council, and this is a pre-apprenticeship program, and it went very well, great. But we saw this continuing theme emerge, right? That folks, these rank and file workers, felt like, great, I feel empowered, I want to do something, but how much can I do? I'm just the worker at the site, I can only do so much. So we put together an instructor and leadership program to train and educate instructors to go back and do and deliver training at their workplaces, and also leadership training to help people put together these policies and programs. And we had some great folks. We had Jim Frederick, who would end up becoming acting OSHA secretary, help organize one of the leadership trainings, so the right guy for the job. We had the city of Concord in New Hampshire develop one of the other leadership trainings. And when given the opportunity to address and educate folks who are in that position of leadership, they do it. They take that action, and they have massive impacts. So we were not just focusing on that individual level, but that systemic change. But when we tried to do this leadership training, it was also in March 2020. I can see everybody nodding their head. If you forgot what happened in March 2020, get out to it. So we had to switch to an online format. I know that, Zoom right now is burning y'all out. If anybody gives me another Zoom call, I flip, But for whatever years ago, that's a different story. People weren't used to Zoom. They weren't used to these online technologies. Some people were using it for the first time in their lives. And we had to address stigma and drug addiction on Zoom, right? So not only did we have to educate folks on the dangers and the connections between work and addiction, but we had to train instructors to effectively deliver online training and for trainees to receive effectively that training. And we spent just as much time educating folks on online learning as we did the drug epidemic in this country. And because we put in that time, we were able to help build the fluency and comfort of those trainees. Of course, we recognize that because this was COVID-19 and there was a pandemic and there are connections to that, to the opioid epidemic, right? The lack of mental health services, the lack of being together, social support, being able to walk and go to your treatment facility as easily, that we needed to put those together in a training and address not the symptom of drug addiction, but the diseases of mental health in the first place that get people driven oftentimes to these issues. And lately, we've really been emphasizing recovery in the workplace, right? It's one thing to train folks about injury prevention and avoiding it in the first place, but we also need to pull back on this punitive environment, this punishing culture, and make sure that people have access to treatment when they're ready and have sustained access to recovery throughout the cycles of their life. And because we put in that time, we were able to help build the fluency and comfort of those trainees. Of course, we recognize that because this was COVID-19 and there was a pandemic and there are connections to that, to the opioid epidemic, right? The lack of mental health services, the lack of being together, social support, being able to walk and go to your treatment facility as easily, that we need to put those together in a training and address not the symptom of drug addiction, but the diseases of mental health in the first place that get people driven oftentimes to these issues. And lately, we've really been emphasizing recovery in the workplace, right? It's one thing to train folks about injury prevention and avoiding it in the first place, but we also need to pull back on this punitive environment, this punishing culture, and make sure that people have access to treatment when they're ready and have sustained access to recovery throughout the cycles of their life. And to do so builds not just them individually and gives back that level of hope, but it builds this nation's workforce. There are plenty of people right now that can and will work. So I have a couple of slides, and I'm supposed to go through them. So Mitch, don't get me in trouble. I'm just going to flip through them real quick. This is the worker training program. These are some nice slides. This is a nice quote. Some comments from trainees. If you want the comments and all that stuff are in papers and reports, and if you want at the end, there's my email address, so I can always share that with you, and I'm willing to take time to talk to any one of you, even individually after this. These are the examples of the training programs, and I would love for you all to take a moment and go online, go back and look them up, and look up your resources, use them. You're supposed to cite us, but I don't care what you do, use it, right? And the thing's not moving up there, but it doesn't matter. Oh, there we go. Yeah. So, I encourage you all to reach out to me, and I want you all to think about the goal of all of this, right? We want to empower people. We want to empower workers with the knowledge that they're gaining. And by empowering them, they can go back to their communities, to their workplaces, and take action. And not action for action's sake, but for change, meaningful change. The sort of change that has brought all of you here today. You are all here today to ignite what you are passionate about and go back to your local governments, your federal governments, your communities, your research, your academia, whatever. Go back, feel empowered, do something. Take these actions that are meaningful. Because to do so will protect and to save the lives of so many people. So thank you, and I'm happy to take questions.
Well, thank you, Eric. That was really awesome. And I'll let Sharon know that you focused so much on those slides and went through them in quite the detail that they deserved. So thank you.